Increasing diverse enrollment in clinical trials is an absolute passion of mine. And I could talk about it all day, but I know we have a limited amount of time. I think that the ways that we can increase recruitment and enrollment are twofold, right? We first have to recognize that not only are there patient barriers, right, which are often the ones focused on. We talk about distrust of the medical system, especially in the Black population, due to a very sordid history of experimentation in the Black population. Also, when you think about immigrant populations, there's concern about their immigration status and things like that that may interfere with research participation. But I think we have to focus more on the systemic, right, and the institutional barriers, right? Things like very strict criteria for clinical trials that exclude populations that have comorbidities, such as Black populations and Hispanic Latino populations. We also have to look at the barriers and the implicit bias of some of our recruiters, right, for these trials. There are people who don't ask minority patients to be involved in clinical research. I think we also have to think about where we conduct our clinical trials. If they are in the same centers that are getting these results that are not very diverse, how do we think outside of the box and reach out to maybe minority researchers, or put more investment in some centers that may not be as polished as some of our academic centers, and try to raise up researchers and raise up centers in communities where we can reach these populations. So I think that we have to look at it from multiple angles, but we have to focus not only on patient education, but at breaking down some of these systemic barriers that are excluding these populations.